Change of shift report is one of nursing's sacred practices, passing the care of a patient who's been in your care to another nursing professional, passing along the trust that the patient has placed in you to your colleague. Hello, I'm Colleen Swartz, Chief Nurse Executive for University of Kentucky Healthcare. The video you're about to see is an example of an evidence-based, family-centered practice, the bedside change of shift report. The bedside change of shift report includes off-going nurses, oncoming nurses, and the patient, or as in our Kentucky Children's Hospital, the family. Successful implementation of bedside change of shift report is a real-time exchange of information that increases patient safety, improves quality of care and patient satisfaction, increases accountability, and strengthens teamwork. Bedside shift report contributes to a model of care in which the patient and family are at the center of care and are active participants in their care. Bedside report also increases the patient and family trust in us, their caregivers, and reduces their anxiety.
Knock, knock.
Hello.
Hey Sadie. How you guys doing?
Doing good,
Doing
thank
okay?
you.
Good. Well, it's about 6:30, so it's almost time for a change of shift.
Okay.
So we're going to be switching gears into that. I just wanted to check and make sure there wasn't anything you needed. You know, if you need any more diapers or wipes or...
Some size 4 diapers.
Okay. I'll get those just as soon as I
Okay.
leave. Is there anything in here I need to get out or everything good?
No, I think we need all this stuff.
Okay. All right. Well, then the only other thing is let me mention again about the bedside rounding. Now, you heard about that when you first came in. Basically, it's just the same thing we've always been doing. We're just going to do it at the bedside now.
Okay.
And that does a couple things. It kind of increases a safety issue, kind of holds us as the healthcare professional accountable. So we're making sure and checking that we're all doing what we're supposed to be doing. But more importantly, it gets you involved. And the more involved you are in the plan of care, the better care we can give your daughter. Okay. So one other thing, if there happen to be other people in the room when we come back, I will be asking everybody to leave other than the parents and the immediate caregivers. And that kind of keeps HIPAA happy with us. But that doesn't mean if you've got a family member or friend that you want to be present, that's absolutely fine. You just have to consent to that and just let me know.
Okay.
Okay? All righty then. Well, I'll go get your diapers. I'll be right back, and then you'll see me again in about 30.
Sounds good.
Okay.
Thank you.
Bye, Sadie.
So
I'll be
bye-bye.
back.
Hey guys, what's up? Morning. Hey, you ready? Yep.
Knock, knock.
Hi.
Hey, I warned you we'd be back.
That's great.
Mom, have you met Andrea yet?
No, I have not.
Okay.
Nice to meet you.
Nice
This
to
is
meet you.
Andrea.
And
She's
who's
gonna
this?
This is Sadie.
This is Sadie.
Sadie?
Andrea's going to be your nurse today. She's been with UK for several years,
Okay.
and I know she's going to take great care of you.
Great.
Okay. We're going to run through our safety checks real quick first
Okay.
before we actually start the report. Okay. Miss Sadie's got her armband on. It's on her leg.
Can I see your armband, Miss Sadie Bear? Let's see. Okay, and this is Sadie Sharp, and her birthday is 9909.
Yes, ma'am.
Correct.
Great.
You've got your oxygen, ambu, and suction all set up,
Just check those really quick.
and then her fluids are hanging, and your tubing is current.
Is she supposed to have D5.5 plus 10 of K going at 40?
That's right.
Okay. Is it going in her right foot here?
Yeah. She's got a 22 there, and it's been
pull
working
this
like
off for a
a
second.
dream. Just flushes great.
Oh, yeah, it looks really good.
And then we've got the emergency medical or med sheet hanging up on the board.
Okay.
All right.
Sadie Sharp.
So we're going to start report. Generally, we only ask that the parent and the caregivers remain in the room. So I'm going to ask if you'll step out.
She's Aunt. I'd like her to stay.
All right, that's fine.
Hi, Aunt.
Absolutely. Absolutely. All right. Mom, if you have any questions, you want to add anything, any concerns, I want to hear about them, but if you would, let us get through our checklist first, and that way we don't risk missing anything, okay? And then just when we're done, you can bring it up then, okay?
Okay.
All right, great. Well, so Miss Sadie Sharp, 3-year-old, date of birth 9/9/08. She came in on the 5th.
About what time did she get up to the floor?
About 10 o'clock last night.
Okay.
She was admitted to General Peds, Dr. Bennett, brought in with diagnosis of drug ingestion.
Oh, what did she get into?
She got a hold of some Valium.
Uh-oh.
She has an allergy to amoxicillin.
What happens when she takes amoxicillin?
It's just a rash,
Little
is that
rash.
right?
Okay.
Just a rash. She's 81.5 centimeters, 9.5 kgs.
Okay. Is she in any isolation for anything? Okay.
We're good there.
Okay.
All right. So, recent admit history, not sure exactly what time she might have gotten a hold of the drug, but Mom noticed through the day her becoming more lethargic. She wasn't eating, she wasn't drinking, acting a little silly.
And this was yesterday, Mom?
Yes, ma'am.
Okay.
So brought her in. Other than, as far as past medical history, frequent ear infections and just seasonal allergies is the only thing we have, right?
Yes.
Is that
yes.
correct? Okay. And then she had, as far as procedures, she had tubes put in about a month ago.
Okay.
No abnormal values as far as labs are concerned, of course, other than the positive drug screen for the Valium, but everything else is looking good.
Okay.
So you saw her 22 in the right foot,
Yes.
and then the fluid's running at 40. Her vital signs are Q4, and everything's been within normal
No
limits.
temps or anything? Heart rate's been stable? Okay.
Yep. She's on a regular age-appropriate diet.
She been tolerating that okay?
She's been tolerating what she's taken in, but her intake overall is still kind of poor. But I think we're turning the corner there. I think that's gonna start doing much better here. Probably will be able to stop the fluids, I would think, today.
Okay, hopefully we'll check on that.
She's strict eyes and O's, weighing the diapers, of course, and she wears the size 4s.
Are you doing okay on diapers, Mom?
Yes, she brought me some in.
Okay.
Hasn't had a BM since the admission. Mom, do we know when?
Yesterday morning she
Yesterday
had
morning?
one.
Okay.
Okay,
All right.
great.
Up with assistance. She's still a little wobbly sometimes, but no pain issues, no skin issues. We don't have any wounds, special orders, nothing like that.
Okay.
As far as scheduled labs, they do still have a CBC ordered. I can't imagine that they're going to continue that either, honestly, but you might want to just follow up with them
Yeah,
on
I'll
that.
follow up with him about that.
She takes her meds like a champ. She swallows pills
Really?
whole. Just put them in a little applesauce or a little pudding or something.
Oh, awesome.
And as far as educational needs, we spoke with Mom and talked about proper storage of medications and poisons and that kind of stuff. We didn't really talk so much about like general safe proofing of the home, though, because so maybe if you get time, you guys can go over some of that today. And I don't see why she won't go home. Maybe late tonight, but at the latest, I would think tomorrow morning.
Yeah, she looks great.
Yeah. Okay, Mom, do you have anything you want to add or any
have any
questions,
questions about
concerns?
anything?
If she keeps drinking well, can we take the IV fluids off?
Yes, I'm definitely going to check on that because
Okay.
it looks like, she's been drinking good just in the few
Yes.
minutes we've been in here.
She really turned the corner, I think, this morning.
Awesome. Great. She just needed a little rest.
Yeah.
Uh-oh. Careful.
All right, well, we're going to go on then and continue
Okay.
with report.
Okay.
Somebody should be in within the hour.
Yeah, I'll be in within
Okay.
the next hour. But if you need anything when I'm not in here, feel free to use your call light, okay?
Right, thank you very much.
And thanks for letting me take care of Sadie.
Thank you.
I enjoyed meeting you, Miss Sadie. And I'm
Thank
back
you.
tonight, so maybe I'll be able to take care of you guys again.
All right, thank
All right,
you.
Thanks.
Bye-bye. Okay. Before we look at the MAR, I just wanted to mention the consults.
Oh, yeah. Is there a social service consult?
They have ordered one. I didn't mention it at the bedside because I'm not sure Mom's aware of it just yet.
Okay.
But they're going to have Wally come in and just talk with Mom, make sure this was a isolated accident and
Right.
not one of several unsafe situations for the child at home.
Has Mom seemed appropriate?
I think
so
absolutely,
far?
yeah.
Okay.
Yeah. I really don't have any concerns. I think it's all
Right.
fine. So I don't think it's going to hold up her discharge at all.
Okay. Let's
All right. Yeah.
pull up her MAR and see what we got going on.
Okay.